Go ahead and start.
Yes, please.
Good afternoon, everybody, and thank you for making this our first Zoom press availability during this crisis. Thank you for coming out to hear what the county executive has to say, as well as our health officer and our director of emergency management. The way that we're going to do this today, obviously we're reacting largely to some of the things that the governor said during his press conference today. But in addition to that, this will be our opportunity to share some of the progress that we've made, some of the things that we've been doing over the last few days to prepare for what many have started talking about as it relates to the surge, but also some of the things that we've been dealing with from a county perspective on a day-to-day basis. We're going to start today with our three speakers, leading off with County Executive Mark Elrich. Following him will be our health officer, Dr. Travis Gales. And then following him will be our Director of Emergency Management, Dr. Earl Stoddard. So, Mr. Executive, if you'd like to start us off with a general overview of a few things. One, your reaction immediately to the governor's comments today, I guess particularly on the stay-at-home order, as well as a couple of other issues that you might want to share before we go on to Dr. Gales.
So I got to say, I wasn't surprised by the governor's announcement. I think when I did a press conference last week, at one point in the conference, I said, we're only one step away from this, and we've taken that step. I think it's the right decision, and I think it's an important decision, and it is a little bit different because in his previous executive order, he was asking people to stay home, and now he's telling people to stay home. He's expecting state police and local police to enforce this. If you're out for a non-essential reason and the police stop you, it could be, I think if I read it correctly, pretty substantial fine and a year in jail. So he's treating this very seriously. He is asking that the local law enforcement enforce it. And one of the other small nuance changes I noticed in there was that they're no longer going to allow pickups, but they're going to allow delivery. So if you've been going out to pick up stuff, it looks like you're not going to be able to go pick it up. You're going to have to take delivery. And deliveries are going to have to follow the protocols that the state has for social distancing. So that was the one really discernible change that would affect, I think, how people were operating. You know, we're not in the surge yet, but we see our numbers going up every day. And we see what's happened in other jurisdictions. Those numbers continue to go up. And that has everybody deeply concerned. I'm sure Travis can, talk more about it from a medical perspective. But we know that we're heading toward a surge. And so the issues, are how do we, how are we going to deal with that? And how large is it going to be? There are a couple other things in there that I do want to call out. One is the governor's opening two, what they told me would be prototypes of drive-through testing centers. And the reason they're prototypes is because they don't have enough kits to stand up the 5 they wanted to stand up. The last time I heard, they had less than 500 kits. They thought those would all be gone in a matter of an hour or two if they open up facilities, and they didn't want to open 5 facilities, give everybody 50 kits, and then say, sorry, I can't help you. And they're also worried that they don't know when the supply is coming in to maintain them. So you'd want these centers to be open every day. And also, as I understand it, the centers continue to require a reference from a doctor. So these are not drive-in centers where if you just feel bad, you can get tested, but they require a referral. MedStar has stood up a center in Montgomery County, but that also requires a referral, as I understand it. And so we still don't have general widespread testing available. I know from everybody I've talked to at the hospital level, everybody has been struggling the past weeks to either get the tests into stock or get the reagents into stock. I know that I was told by one hospital that they were testing people and it was taking 4 or 5 days to get the results back. This is critically important for hospitals because the reason why everybody is using up the personal protective gear is because they don't know which patient has COVID and which doesn't. And so they're being forced to take precautions with every patient. And once they know who has the gear, who has COVID by being able to test them, then they'll be able to focus the protective gear on people who really need it. The other issue that remains problematic is what we're going to do for surge capacity. We are working with the state, but my conversations with the hospitals indicate that we are going to stretch to try to get to 500 beds. And if estimates are larger than that, we are not prepared at this moment for larger than that. People are looking to see what other facilities they can bring into play. But this is it's one of the problems with the state not sharing their modeling with us. We're not quite sure what that number is that we're supposed to be looking for and planning for. So we've asked them to share modeling. We've asked them to work with us closely on bed capacity. And we're working with everybody to try to figure out where we get the testing from. So those are the, my big takeaways from this. I've said this before, this is something that we control. And the reason why the governor went from, I wish you would do this, to I'm ordering you to do this, is too many people were still out socializing, still meeting in parks. And the only way that this virus is going to get spread is by what we do to spread it. And the only way it's going to be avoided is by what we as people do to avoid it. And this is one thing that is completely under our control. And many jurisdictions, we're not the only one, I don't think it's sunk into people because we've never been through anything like this, just how serious it is and how serious one has to take this notion of social distancing and minimum interaction with people. I think it's really important, and until somebody brings in a medicine that works and a vaccine that works, the best line of defense are the things that everybody chooses to do every day. That's my 2 cents at this moment.
Thank you, County Executive. We're going to move on to Dr. Gales to give us a health overview. Dr. Gales.
Good afternoon, everybody. Good to see you all again. Sorry under these circumstances. To level set where we are, I want to remind you of where we started the conversation. Now, it feels like months ago, but it was really only a matter of 3.5 to 4 weeks ago, where we talked about the factors that we would look at to adjust our course of action. The first step was if we started to see an increase in the number of suspicious cases, then if we started to see an increase in the actual number of cases corresponding with evidence of community transmission beyond just travel related. And that last component that we were watching carefully or have continued to watch carefully is looking at the percentage, the type of morbidity associated with it. So are we seeing an increase in hospital burden? Are we also seeing a comparable increase in the utilization of intensive care services, as well as are we seeing an increase in fatalities? And so, as you know, obviously we have kind of moved through each of those different categories. We have seen our first cases back on March 5th, the first case in Maryland and in our jurisdiction. And that number has increased from that first night, that Thursday night, from 3 to 341 as of this morning. And that number for Montgomery County, and then from 3 to 1,413 Maryland residents who've tested positive for COVID-19. In addition, we know that based upon the estimates from the state this morning, that approximately 20 to 25% of those cases are currently hospitalized. It's unclear as to the percentage who are in intensive care services, but the overwhelming majority of cases, both in the state as well as our local jurisdiction, remains in that 18 to 64-year-old age group. Now, the other marker that we've been looking at is the number of fatalities. And we've had one fatality, COVID-related fatality, of a Montgomery County resident. But the number of fatalities that are COVID related across the state have increased to 15 as of this morning. It's impacted across age groups, but the majority of cases have skewed towards the older population who have had underlying medical conditions. Not to say that it's not impacting other folks. So from an epi perspective and a surveillance perspective, that's where we are. What I have been cautioning folks on is, yes, follow the number of cases, because that's an important marker. But the thing that we're really targeting is looking at the percentage of folks who are in the hospital, requiring hospitalization, requiring an escalation of care, and unfortunately, ultimately, fatalities. Now, over the last week, we've also seen increased attention to our vulnerable populations, particularly those in nursing homes and long-term care facilities. We prioritized those groups early on in the process and making sure that they had up-to-date guidance in terms of how to protect their residents. Unfortunately, over the last week, we have had 3 facilities impacted in our jurisdiction. 2 were impacted by having a staff member who were from other jurisdictions test positive for COVID-19. And in the third instance, we had a facility where there were multiple residents who tested positive for COVID-19. And we continue to provide guidance and support to those entities, as well as other nursing homes and long-term care facilities across the jurisdiction. And we send our thoughts and condolences to our colleagues in Carroll County as they navigate the nursing home investigation there, where they've had over 60 residents test positive, and unfortunately have had, I think, 3 or 4 fatalities to date. One other thing I want to talk about that has been discussed and County Executive Elrich referenced is this notion of testing capacity. As you may have noted from some of my comments in last week's council briefing, I expressed frustration on that. We continue to deal with testing capacity even where we have sites popping up to provide those services. And I want to be a little bit theatrical, but to show you a prop to emphasize where we're going historically with testing capacity. This is a manila envelope. It's a plain manila envelope. When we first received testing kits from the state, which were part of the provisions from the federal government and CDC, we received a manila envelope with 31 test kits. That's it. Since then, we've used some of those to, as part of our contact investigations over the course of the last 3.5 weeks. We have been able to piece together, working with some of our private lab partners and our healthcare providers in the county, to try to get other test kits so that we could be able to stand up a mobile type testing event. We continue to try to scrape together and pull together those resources to be able to do something so that we have opportunities and alternative test sites for individuals to be able to get tested if they need. I want to emphasize that testing is still for those who are symptomatic and are being prioritized for individuals who are hospitalized, first-line responders in terms of healthcare providers who are symptomatic or those who have knowingly been exposed, individuals who are symptomatic and have symptoms that cannot be explained by other diagnoses, and individuals who are symptomatic where a diagnosis of COVID may influence the treatment plan based upon, again, any other comorbidities or other underlying medical conditions. Just want to again reiterate that testing at any level across the country is not at on-demand testing for those who aren't demonstrating symptoms or have other complicating factors. So as testing capacity hopefully ramps up, we have been continuing to work with the state in terms of exploring some of our own venues here to be able to provide those services for residents, because we recognize that early testing and early detection is an important and fundamental tool in terms of curbing pandemics, because early detection allows for early implementation of quarantine status. And even in the setting of social distancing and significant restrictions on where people can go, it makes sure it limits those opportunities and transmission windows for those individuals. The last component, and I know Dr. Stoddard will talk more about this, is we have been engaging in active conversations with our health systems and our hospitals around this notion of surge capacity. We have explored and discussed creating a multi-tiered approach to be able to provide the types of services we need for our residents. That includes a whole host of things, such as making sure that the facilities are used for urgent care and hospital care, not using it for elective procedures, those kinds of things, as well as looking at how we can reconfigure the current blueprint in each of the hospital settings and how we can expand the blueprint as it stands. And the last component is looking at how we can utilize other spaces, current venues such as old hospitals or office spaces that have previously provided clinical care as other sites to be able to provide the resources, whether it's hospital-based care, quarantining places, or other places where we can expand our testing capacity. I'll stop for there, but we're happy to answer questions later.
Thank you, Dr. Gales. We're going to hand it off now to Dr. Stoddard, our Director of Emergency Management, who will give an overview of a number of the things that the county's been engaged in over the last couple weeks. Earl?
Thank you, Barry. I want to start off by talking about what we heard from the governor this morning about the wireless emergency alert that will go out statewide later today. That will be, we've done a test of that in the National Capital Region before, so it should be familiar to many of our residents. It's a loud, pretty obnoxious ringtone that your mobile devices will produce, and it'll warn about the stay at home. People should understand when that comes through. It's just a further notification. But I would also add, we're going to pair that with a full system alert Montgomery message on the back end to make sure that even those who don't have mobile devices, maybe those who are just email sign-ups, will receive those alerts as well. So I think that's going to be important to pair those two things together. We have a few things. We have a lot of things going on in county government I want to touch on. But number one, our DOT ride-on services are operating at what we call an essential service schedule. And what that means is it's focused on access points to our hospitals, our public school feeding sites, our dialysis centers, our grocery stores, our pharmacies, and other healthcare locations. And so we are restricting use of ride-on to make sure that we can focus those resources on the critical kinds of life safety issues that people should only be leaving their house for. Obviously, that's in very much direct support of what the governor has done now with the stay-at-home order. A couple changes to our fire rescue system that people may be aware of, but I want to highlight. Number one, on Friday, they launched a mobile integrated health vehicle system whereby an EMT and a paramedic will actually respond to low acuity calls in the public. They'll triage those calls and identify whether the persons may actually need a full complement of resources, or if they're not ill enough necessarily where they need to be taken to the hospital. And so it's part of their pandemic triage protocol that was developed in concert with the Maryland Institute for Emergency Medical Services Systems, MIMS, to make sure that we have a pandemic procedure that recognizes just the volume of calls is going to increase over time, and we need to make sure that we can provide adequate resources to those who need the resources the most. Right now, through our 911 center, we're flagging about 50 calls a day that flag for our pandemic review questionnaire, which is essentially questions that ask about fever, respiratory distress, or coughing for anyone in the household, about 50 of those calls per day. We also get between 12 and 15 of the large gathering reports, meaning that people are reporting seeing large gatherings or other things, and we respond to those in enforcement of what was the existing orders, but now in the stay-at-home where we'll see the same things. One of the big things that we've gotten a lot of inquiries about is volunteers and donations. We've set up a donations link, an email address, donations@montgomerycountymd.gov, that we will use to receive donations that can be directed towards the county, but also to our nonprofit and other community partners. So we're taking in things through that avenue. We're triaging them and assigning them to the correct place. If there are people in the community who wish to sell us PPE and other resources, you can reach out to procure@montgomerycountymd.gov to provide those resources. One of the big things we've seen a lot of both interest in providing, but also requests to support, is now that we're down to this essential services schedule on Ride On, a lot of people have raised concerns about making sure that people, particularly our vulnerable populations, can access food. And so the Food Council has really taken on the leadership role of coordinating both the volunteer resources available to and receiving requests for home delivery of food and other things like that. Those activities are ramping up. Many of them are coordinated with the county, but many of them are just pop-up community members making themselves available to support their neighbors, and we certainly encourage that. And so I think that's all I really wanted to hit on for today, and certainly I think we could take questions.
Okay, thank you. In an effort for us to kind of keep this online chat organized, what we'd like you to do is to use your chat box and to send your questions in writing. What I will do is read them out loud and allow either Dr. Gales, the county executive, or Dr. Stoddard to respond. Dr. Stoddard, could you give us the link for the donation? Do you remember whether there was a link for that?
Yeah, it's right on our, it's right off the COVID page. So montgomerycountymd.gov/COVID-19. There's a link from there that will take you directly to, it's actually affiliated with the, I think, the Volunteer Center, but yeah, there's a web link there on our COVID page.
All right, we've got a question here from Jesse Arnold from WUSA 9, and this is to you, County Executive Elrich. To your best interpretation, can you provide clarification on what counts as essential activities and items of purchase? For example, would going to stores to buy gardening or house painting supplies count? Or could you receive a fine for that? How will law enforcement determine whether or not someone is out and about for essential reasons?
So I was just looking at the governor's press release here. It's the paper you hear shuffling. His definition, he says, obtaining necessary supplies and services for oneself, family, household members, pets, or livestock, including, without limitation, groceries, supplies for household consumption or use, supplies and equipment needed to work from home, laundry and products needed to maintain safety, sanitation, and essential maintenance of the home or residence. That's the sort of definition of it that people are going to be working with, and that's directly from the executive order. So a lot of stuff's not going to fit in that. Clothing shopping, jewelry shopping, knickknacks, any browsing. I think that's why the stores you originally left open were the multi-purpose box stores that had food, even if they had clothing in them, but they had to, be selling food. And Home Depot, because it has home supplies, electrical, plumbing, and stuff like that that a person would need. And the grocery stores and the liquor stores. But those were, that's what he left open. And then businesses as required.
Barry, I can add to that a little bit.
Okay.
I actually think the governor actually took a question where he was asked about, his idea of essential. And the example that he used was if you had a leak in your house, like the plumbing was leaking and you had water coming in your house, that would be a reasonable repair that you would make that would be deemed essential. But if you decided you were just going to do, some yard maintenance, that's not an essential activity necessarily, and therefore would not be deemed an appropriate use. Now, the challenge will be obviously for law enforcement to have to weed that out. They'll be given some discretion, but I think obviously what today's reflection was, they've been trying to be relatively generous with people, and today is a ramp up that they're going to be a bit more aggressive in enforcement. I think people need to understand that.
Thank you. Any other questions? I don't see any popping up.
Hi, I have one. I'm just not too facile in typing it in. But I have a couple things. To the county executive, can you be a little more precise about pickup and delivery of food from restaurants and establishments? Does that mean I can't go to a restaurant and pick up dinner for my family tonight?
I am trying to get the exact wording down, but I noticed that the governor actually issued 4 executive orders today. And this is under the other executive orders. And if you give me a moment, I will see if I can find it. And maybe I'll give you, if we can get some clarity.
And I will only note that you all should be receiving the wireless emergency alert from the governor as we sit here. So
I just got
went
it.
out.
I just got the emergency alert. I am not finding his exact executive order. And that's what you need to look at, because it has the executive order and then it has the additional, the other 3 executive orders under the one that everybody's focused on. But I'm sure you it's on the page. I wish I could find it easier. I've got his news reports, and they don't have all 3. They don't have all 4 orders in the news reports. Want me to continue to look? Is there another question?
No,
up
no.
there?
Why don't we move on to the next question, if there is one, and we'll try to get an answer specifically to that from Mr. Collins.
Well, again, I have another one. And
Okay, go ahead.
my typing skills are not good. But does that mean that if someone wants to paint their house, that would be prohibited under the governor's new order?
If I were interpreting his order carefully, I'd probably say yes.
And then I'd like to go to the number.
Let's put it this way. You could paint your house, whether you could go out and buy paint and paint brushes, as opposed to go out and buy, you know, something to fix an outlet or to fix bad plumbing. I think you'd have a question there.
So if something's broken, you can go out and get supplies to
Yes.
fix it, but you can't start a new project. Is that a fair interpretation?
Sounds reasonable to me.
Okay. And then while you're still looking, Mr. L, I'd like to talk to Dr. Gales about hospital beds. How many hospital beds are there presently in Montgomery County?
I think somewhere in the neighborhood of approximately 1,400 beds.
And of those 1,400 beds, how many are occupied by coronavirus patients? Do you know?
I think So using the state's estimate, it's about 20%. Well, let me take a step back. So I don't know the exact number of the beds in the county that are used for COVID patients right now, but based upon the numbers, we approximate that approximately 15 to 20% of the cases are hospitalized. So extrapolating from that, we've got 341 cases. I would wager probably somewhere in the area of 20 to 25 cases within the county are hospitalized at this point, utilizing those spaces.
And doctor, one other thing, of the 1,400 beds, how many are occupied now with any patients at all?
Again, I'd have to get the most recent stats from the state. I think we are at about 60%, 60 to 65% capacity. We are not at surge levels based upon our current numbers. Again, but we know that can change very quickly, which is why we are working to make sure our plans and strategies are in place now, that we aren't at that crisis level, and so that we're not responding and waiting for us to get to that point where we cross that threshold.
And doctor, I'd like to go back to your envelope. Did you say that when you first got these tests, they all came in that one envelope and there were only 31 of them?
So
Did I hear you?
This isn't the actual envelope. I went to look for the actual envelope, but you can get the picture. So originally so going back to when this first started, if you all, and again, this seems like so long ago, the only place that was doing tests was the CDC. So you had to send all of your samples through the state, and they were sending them to CDC to be analyzed in Atlanta, and then the results would be sent back. When the decision was made to allow for state public health labs to test in lieu of CDC, states were given test kits, and they had a limited supply based upon what they got from the government. And so what they did, it's not a COVID-related cough. What they did is they sent out an allotment to each of the jurisdictions to say, here's based upon what we have, we're trying to break these down and give each of you a supply to be able to use. And so we did receive a manila envelope of test kits that we were to use. For example, we used, going back to our first case, one of our first cases where there was a nursing home that hosted an event where the person attended, we actually utilized over half of that supply to test individuals who were considered to be high-risk exposures at that time. So since then, we've been able to, we don't physically have, we still have some kits left over here, but since that process has evolved, whether it's us or hospitals who are testing and sending it to the state lab, they're able to send to the lab directly. And the state lab is prioritizing based upon that criteria I laid out before. So priority group A are folks who are hospitalized, who are significantly ill, who need a quick diagnosis. And by quick, I'm meaning the state can turn around with their capacity. They can turn around labs within a 24-hour period, best case scenario, versus those, utilizing the private labs. If I'm coming in with mild to moderate symptoms, on average, it's taking 48 to 72 hours for those results to come back.
Thank you, doctor. And now,
Patrick, I have your answer.
now back to the county executive.
I have your answer.
Okay, shoot.
So they sent out a clarifying, and it's only non-essential businesses that are now curbed from doing curbside pickup. But bars and restaurants can continue to do carry out and drive through and delivery. Anything else, anybody else who was doing curbside pickup can no longer do curbside pickup.
So if you're a bar or restaurant, you can still provide food and
Yep.
beverages to be picked up.
For pickup and for carry out.
That'll make my dinner plans much easier.
Yeah,
Thank you.
it worked for me last night.
Thank you. Thank you.
Do we have any other questions? Going once, Going twice. 3 times. Well, thank you very much, everyone. I want to thank the county executive for taking time out. Also, Dr. Gales and Dr. Stoddard. Also want to thank our media partners for coming in and getting some information. Please know that you can reach out to us through our COVID comms team. If you have any follow-up questions that you'd like to get an answer to related to this, and certainly look out for more information from us as the days and weeks and probably hours and minutes go by regarding this crisis. But thank you very much, everyone, for showing up.